It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated patients and medically complex patients at home, including home TPN, home IV potassium infusions, home IV magnesium infusions, also home IV antibiotics. So today I want to talk again about the palliative care aspect of our intensive care at home service. And the reason I want to talk about that we recently have done quite a few very nice palliative care situations at home where the wishes of our clients were clearly not to go to hospital. And the wishes were clearly of those clients to have their remaining days, weeks, and months at home and not ever go back to a hospital. And of course, with our service intensive care at home, we were able to provide that for them with 24-hour nursing care, 24-hour specialized nursing care, with intensive care nurses, and provide that wonderful end-of-life care at home. It's an absolute privilege to be able to provide that. All of our nurses, we have all worked in hospitals for decades, and quite frankly, we have seen palliative care being done very, very poorly in hospitals. Families often literally begging to have palliative care at home, but the hospitals, can't think outside of their box how to make that happen. They're lacking the resources sometimes as well, and also they're lacking the service providers in the community that can make it happen. And we with intensive care at home, we have a very good and proven track record to provide 24-hour palliative care situations at home, where we can really meet our clients and their families' needs to pass away at home and not go back to a hospital. So we've just provided palliative care for a 94-year-old lady at home who passed away in the last few days. And again, her wish was she did not want to die in a hospital, and our wonderful team of nurses, but also our wonderful admin team has managed to enable that for her by putting a roster in place, by our nurses going there 24 hours a day, and have her pass away at home. Now, I also want to highlight this and thank you very much here on that note as well to the DVA, to the Department of Veteran Affairs for funding the service. And I know that a lot of hospitals struggle with, having enough beds, and, sometimes and often patients die in hospitals over many weeks, many months, and there's no need for that because we can look after them at home. And your hospital should be considering intensive care at home as an option, as a viable option to empty your hospital beds and ask the patients whether they want to die in a hospital or at home. You know the answer. You know the answer to that question. So thanks again to the Department of Veteran Affairs here for enabling this service for their members and for their clients. And we hope that many other hospitals will follow suit here and make funding available, because it's much cheaper to do this at home than it is to do in a hospital. You need the beds in a hospital, but more importantly, where do patients and families want to be, not in a hospital for end of life? If you look at the research, 75% of people want to die at home if they can choose, and yet less than 25% of people actually do die at home. So it's really time to put services in place to respect and honor people's wishes. So that is my video today. Thank you so much for watching. If you have a loved one in intensive care, on ventilation, tracheostomy, BiPAP, CPAP, even if they have a tracheostomy and are not ventilated, if you need home TPN, IV potassium infusion, IV magnesium infusion, if you need palliative care at home, please reach out to us. We can enable all of that for you. We employ hundreds of years of intensive care nursing experience in the community. We bring the highest level of skill into the community in Australia, in the country. There's no other service that has third-party accreditation for intensive care at home. There's no other service that brings more and better skills, nursing skills into the community than intensive care at home. Now, if you are a critical care nurse and you're watching this and you're looking for a career change, please contact us as well. We are looking for critical care nurses in Sydney, Melbourne, and Brisbane. We're looking for critical care nurses with a minimum of 2 years critical care nursing experience. We're looking for critical care nurses that are that can give us regular availabilities. All of our clients want regular staff We are not a nursing agency. We are a service provider. We tailor-make our service to the unique needs of our clients, right? It takes a special nurse working for us. We need the ICU or ED nursing experience, but we also need nurses that can fit into a home care environment because we are not a hospital. That is our point of difference. If you are an NDIS support coordinator, I also encourage you to reach out to us if you need nursing care for your participants or if you need help with funding for nursing care for your participants. We have been heavily involved in the advocacy. We can help you with that as well. If you're looking for NDIS specialist support coordination and you are an NDIS participant or you need help with the NDIS intake, please contact us as well. We have our own NDIS specialist support coordinator working for us. And if you are an intensive care specialist and you're looking for a career change, please contact us. We're currently expanding our medical workforce as well. And if you're a hospital executive watching this, you know you have bed blocks in your ICUs, on your hospital wards for palliative care. We can help you managing your hospital beds. Please contact us as well. We are an NDIS TAC in Victoria, DVA, iCare, NIISQ approved service provider in Australia. But we also get sometimes funding through public hospitals, through private health insurance. Please contact us for any of your needs. And you can contact us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. Now, also, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care and intensive care at home. Click the like button, click the notification bell, share the video with your friends and families. Comment below what you want to see next or what questions and insights you have. And if you are in the US or in the UK, please contact us as well. Even if you need intensive care at home, we can help you, pointing you in the right direction. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com. I will talk to you in a few days. Take care for now.